Achoo! No, really, I'm fine. But as you know, it's almost flu season now, and the real dilemma is, what do you have, the flu or COVID? So what I wanted to do is kind of go over with you what the signs and symptoms are, what the bugs are that cause them, as well as the treatment and the prognosis. So let's go ahead and roll. Flus have been with us forever. And in some cases with the H1N1s and some of the other ones, there's been enormous fatalities and things that have happened, but we've effectively found vaccines against them. And these vaccines have been used year after year. As you probably already know, the vaccines to influenza, which causes flus, are changed up every year, and they cover most of the species and will protect you against that. Unfortunately for COVID, there is no vaccine yet, which obviously they're working at breakneck speed to try to develop. Meanwhile, what are the symptoms of each of these, and what are the similarities and what are the differences? So the interesting part with flus and with COVID is that many of the symptoms are very similar. For instance, you'll get some non-specific constitutional symptoms, what we call aches, pains, fevers, sore throats, cough, and a few other related symptoms. In particular with COVID, there has been a reported symptom of loss of taste and loss of smell, which are unique to it versus flus. And so if you do develop that, that would be a clue as to what's going on. Secondly, depending on your exposure pattern, if someone around you has developed the flu or COVID-19, you know which one of these it could be. But the truth is, when you get the symptoms, you're going to have to get tested. And in the case of flus, generally, we didn't all get tests, but now with COVID-19 on the scene and with the enormous risks of spread and carrier state, as well as the risk to yourself, people are getting tested. And so what I estimate is in the first 24 hours, if you have a high fever, meaning over 101.5 or 38.5 in Celsius, most people are going to suggest going out and getting a PCR-based test, which will diagnose you acutely of having COVID-19 or not. In either case, the treatment is fairly similar until you develop complications. Both of these can cause pneumonias. However, there is a higher potential with COVID-19 and also a higher potential to spread COVID-19. And so these are the things we worry about. Ultimately, there's one saving grace in what we've seen in the Australian data, that the coming flu season may actually be mitigated because many of the same ways to prevent COVID are the same things you do for flus. And what that means is good hand washing, masks, and social isolation, as well as distancing. And so I don't know about you guys, but I have not gotten a cold in the last 6 months in this lockdown. And typically in India, getting a viral is an annual thing, at least once or twice a year. Wouldn't you agree? Thanks.